And we're back with Mark Van Arnhem. He is with the North Carolina Navigator Consortium, and these are the experts, 25 of them, who are ready to talk to you one-on-one about your ACA healthcare enrollment. The number so that you can talk to one of those experts one-on-one is right there at the bottom of your screen. It's 855-733-3711. All right, so healthcare enrollment started in November.
Correct.
You need to enroll by December 15th if you want to start it on January 1st. Let's kind of go through a few things.
Sure.
For people who say they enrolled in a plan during the last enrollment period, why do they need to update their information?
Well, plans and prices change on a yearly basis. For example, one of the insurers that was in the marketplace in North Carolina is no longer in the marketplace, Bright Health. So you may be mapped into a plan from a different, you would be mapped into a plan from a different provider that may not meet your needs. It may be more expensive or maybe less expensive. It's the luck of the draw. So go in, talk to a navigator, or even if you're comfortable with going to healthcare.gov on your own, do that and update your information. New plans and prices are available. It'll update your tax credit information, and oftentimes people are seeing much lower premiums thanks to the enhanced subsidies that we spoke about earlier.
So we have a lot of people who left the traditional workforce and are doing some of their things on their own, and this may be the first time that they've ever had ACA Marketplace stuff. So what kind of plans does the ACA Marketplace have?
Yeah, so this is something that is a great question. A lot of folks think of it as, oh, is this bare bones government insurance or something along those lines, and that's not it at all. It's Blue Cross Blue Shield, it's Aetna, it's the coverage like you and I would get from our employer or anyone else from our employer-based coverage. It's private quality insurance that is affordable for folks and will cover everything that they need.
Right, but it's not like one policy, or it's not even like there's three.
No.
So when you go on the ACA Marketplace, there are dozens to choose from.
Yes.
So how are the policies different?
So they're colored by metal levels, they call them. So there's bronze, silver, gold, and there's platinum plans. So when you go through those plans, you'll see the different options that are available. A bronze plan has a little bit less, the least coverage, and as you move up through the metal levels, you get additional coverage. Oftentimes the price will go up, of course, between those levels, but again, that's where those tax credits come in so handy and keep that price low for you.
Gotcha. Okay, so whether you are looking for an ACA Marketplace or not, you have insurance, or maybe you know someone who has insurance, and there's a lot of words that are thrown around all the time. So co-insurance, copay, deductible, what is the difference in all those things? So
copay is what you're going to pay when you go to the doctor. When you go get your prescription, your deductible is what you're going to pay out of pocket before you go and get most of your insurance benefits to kick in. So a lot of folks want to come in and they want to find something with a low copay and a low deductible. That's super important to them. So there are those plans on the marketplace. We are there to help you find them. But we also want to make sure that we're finding a plan that's right for your needs. So we'll go through your doctors, make sure that they're in network. We'll go through your drug formulary, make sure the medicines that you take are in your network too. So you're paying that low copay for those medicines when you go pick them up at the pharmacy.
Right, because depending on whether you go to the doctor a lot or you don't go to the doctor a lot, or whether you have kids or whatever else, that's going to determine maybe what plan you go to, especially maybe I want one that's a high deductible because I don't go very often and I want the copay to be smaller.
Yes, and that's, a lot of folks want that, and it does. It very much depends on your certain situation. So our navigators want to sit down and learn about your situation and understand what your needs are so we can help you find the right plan for those needs.
Okay, and so we have these health navigators here until 6:30 tonight. That number is at the bottom of your screen. When you call one of those navigators, what happens?
So if you're calling one of them now, they're going to answer the questions that you have. Make sure that you are as well informed as possible on this call here. We're also going to offer you a free appointment, whether it be in Zoom, phone, or in person, for help with enrollment if you want application assistance, and then plan selection. If you don't want that and you just want to ask some more extended questions, we can schedule you a free appointment just to get on the phone and ask some questions with folks. But we're here to answer most of those questions for you tonight.
Right, and sometimes text questions, it's too much to text because you got this and that, and I got this situation, whatever else. So this is a way for you to be able to talk to someone and really get all the information out and let them ask you some questions that might help you really figure out what plan is best. All right, we're going to take a quick break, but we're going to be back in just a few minutes. Remember, those experts are still answering the phones even when we're not here.